my name is Hallie, and today I'm going to be talking about Myasthenia gravis. This is for an oral presentation topic for my microbiology class. So a little bit of a background about Myasthenia gravis. So this is kind of hard to see, but this is the best that I have to work with, so I'll do my best to try and explain it all. So Myasthenia gravis is a neuromuscular disease, and it affects the skeletal muscles by causing them to weaken, and it makes it harder for daily activities to be done. And it can also be several years or lifelong for a person with this. And the muscles weaken as they are used. So once you're active, you become weaker, but once you gain rest, your muscles start to regain their strength. But once again, when the person gets up, starts walking, they're still going to lose that strength when they start using the muscle. So it's kind of counterproductive, and it kind of hurts itself in the disease. So most individuals with this disease have a normal life expectancy, and they are not usually as bothered, but it does take some getting used to because you get tired easily and you need long periods of rest. And also in the corners, it's not very good to see on this, but right down here I have my sources that show where I got my information from. So next we're moving on to signs and symptoms of myasthenia gravis. And down here is a little picture of what someone with this will maybe look like. This is one of the most common symptoms. So getting into the symptoms, as I said earlier, the muscles are weakened as they are used. So it's important to take long periods of rest, and symptoms will usually improve along with the muscle weakness when the person gets adequate rest. And muscle weakness kind of comes and goes. It's not always a certain thing that it will happen or it won't happen. And symptoms tend to progress over time, so the longer a person has it, the worse the symptoms usually get. And they usually reach their worst in a few years after having this. So in more than half of people who develop myasthenia gravis, their first signs and symptoms involve eye problems. So as that picture showed, that it's one of the most common first symptoms. And you can have drooping of one or both eyelids, which is known as ptosis, or you can also have double vision. So those are your common eye problems that you'll see with a person with myasthenia gravis. So moving on to more symptoms continued. In about 15% of people with myasthenia gravis, the first symptoms involve the face and the throat muscles. So with this, with the throat, you'll have impaired speaking, and the voice can become, they might sound soft or nasal, and that really depends on which kind of muscles are being effective in the throat. And this also can lead to difficulty swallowing, which then leads to concerns of choking, aspirating, etc. That can be very dangerous for this person. And also with this, with changing the muscles, this can also change the facial expressions. And in my research, I seen that a simple smile can maybe look like a snarl in a person with myasthenia gravis. So that is also another common sign and symptom. So myasthenia gravis can also cause weakness in your neck, arms, and legs. So a person with this might have drooping of the neck, and it can be hard to hold their head up. And arms and legs, it's harder to walk, pick things up, and anything that you can really do with your arms and legs is just overall harder for a person because of that muscle weakness that accompanies this. And also I have my source down here in the bottom for this one. And this is a little picture here, and it's kind of an overall view of the symptoms a person might experience. So they will also have breathing difficulty, so making it hard for those chest muscles to do their job. Difficulty chewing and swallowing, as I said, and that can be dangerous with choking, and that is something family members and the person with myasthenia gravis should want to keep an eye on and make sure that they're safe. Also difficulty climbing stairs and lifting objects, that comes in with your arm and leg muscles, and that's just your generalized weakness. You'll also have difficulty in talking. As I said, the voice can change, and that is not fun for a patient, and that is also very hard to change when you do have myasthenia gravis. And as I said, drooping of the head, you can lose neck muscles, so it's harder to hold your head up, change in the voice, facial paralysis, and fatigue, and weakness of eye muscles. And like I said, these symptoms will become better with rest, but once the person is active again, they might just come back as worse as they already were. So, simple causes of myasthenia gravis. It is an autoimmune disease, and few are congenital, meaning that they were present at birth, and these are rare, where the mother will pass the antibodies that have the disease on to the child, but this is also curable in the child, so that is a good sign for them, and not as much as when they get older. So that is something to keep an eye out for in the child, so that the correct cause can be underlying and figure that out, what the problem is with the patient. So also another cause is an abnormal enlargement of a tumor of the thymus gland, and it is associated with myasthenia gravis. So if you have a tumor in your thymus gland or an enlarged tumor, that is something to also keep an eye out, and that could be the underlying cause. And it might trigger the production of antibodies which cause the condition. So that is something that a patient and their doctor would want to discuss, and how that causes myasthenia gravis. And I also have my source here at the bottom for this one as well. And I found a picture online. Let's see if I can get it picked up there. It just states more causes, so I'm just going to read over that real quick. It is a neuromuscular disorder that is usually caused by an autoimmune problem. Autoimmune disorders occur when the immune system mistakenly attacks its own healthy tissue. And in this condition, antibodies, which proteins, they're normally attack foreign harmful substances in the body, attack the neurotransmitter substance called acetylcholine, and which is a crucial substance for nerve cell and muscle communication. So this results in the muscle weakness that the patient will experience with myasthenia gravis, and the exact cause of this immune reaction is still unclear and not very well known about. So those are some simple causes, but still there is no known reason for this certain cause of this. So preventative measures that a person can take for this, I found another picture that I liked that described preventative measures that you can take to stop symptoms from worsening. So myasthenia gravis cannot be prevented, but avoiding it and following the triggers that prevents this from happening are avoiding emotional stress, exposure to extreme temperatures such as fever, avoiding illnesses, respiratory infections, pneumonia, tooth abscess. Those will all keep you in a safer spot from getting myasthenia gravis. Low levels of potassium in the blood, hypokalemia caused by diuretics, and frequent vomiting, that's also linked to keeping yourself from getting myasthenia gravis. And certain medications like muscle relaxants, anticonvulsants, and certain antibiotics are also linked. So we want to make sure that you're staying away from those medications if you're at risk for getting this. And overexertion is also known to link a person to myasthenia gravis, so making sure you get adequate rest and not overusing your muscles is very important. So next up we have treatment for myasthenia gravis, and this is the same way with preventative measures. There's no known treatment for it, but there are medications that can be used to stop the symptoms from worsening. So like I said, no treatment options to date. It's just kind of preventative measures and medications that a patient can take to reduce the signs and symptoms. So anticholine esterases are temporarily reliefs of the symptoms, and they're first prescribed, so they're their first line of treatment, and they are the fewest long-term side effects. so they do not carry as many side effects for the patient, and they are rapid-acting medications, so they act quickly and do their job efficiently. And it prevents the breakdown of acetylcholine, which is the chemical messenger that causes a muscle contraction. So more acetylcholine generally results in greater use of your muscles, so you get more muscle strength, and this medication will prevent the breakdown of your muscles, so that promotes them for more strength. So this is what this patient needs because their muscles are weakening. So the next medication that can be taken are immunosuppressants, and this attacks the disease at its source. So by suppressing the body's immune system, these drugs stop the body from damaging the neuromuscular junction in the first place. So immunosuppressants treatments can have serious side effects, so that is why it's not the first sign for a person to start taking this medication, and they usually start off with the first medication. So doctors may prescribe one or more of a combination of these medications, and it often takes time to determine the best medication and dosage for an individual patient because not everybody will respond to treatment in the same way. And lastly, a person can have a thymectomy, and doctors recommend thymectomies for individuals with thymomas and for most patients under age 60 with moderate to severe generalized myasthenia gravis. So those are some common treatments for a patient, and like I said, that is not a permanent treatment. This is just the best thing that they can get at the time to reduce their symptoms. So that is an overall view of myasthenia gravis, and I also have my source down here at the bottom. And lastly, all my sources listed here. Thank you.